Hello friends, today is our medical discussion episode number 35. Today our topic is primary care of a unconscious person. So my first question is, what are the main causes that can lead a person to unconsciousness?
So obviously this is a very important topic because whenever we encounter an unconscious patient, a lot of us become confused what to be done and what are the precautions that to be taken regarding the unconscious patient. So we say a person unconscious when the person does not respond to any kind of stimuli. Mainly he doesn't respond to pain, he doesn't respond to sound. So there are a lot number of causes which can lead to unconsciousness of a person. Among them, the most important cause is drug abuse. There are a lot number of drugs which can depress the brain and can lead to unconsciousness. So overdosing of these drugs can immediately lead to unconsciousness of a person. Alcohol, increased alcohol intake or excessive alcohol intake can also lead to unconsciousness. So number two, second cause is choking. So sometimes any kind of food matter or any material which obstruct the airway can lead to decreased breathing of the person or decreased saturation, oxygen saturation in the blood. As a result, the brain doesn't get enough oxygen and therefore a person can become unconscious. There is a condition called anaphylactic shock. Because of excessive allergic, there can be swelling in the neck and it can compress the airways, so it can lead to shocking and thus unconsciousness. Another important, very important and very common cause of unconsciousness is vasophagal attack. It is because of excessive stimulation of a nerve which is known as vagus nerve. We have seen or we see that when a person continuously stands for a long time or when a person is walking, so suddenly he become unconscious. So the vasophagal attack, it is a very common cause mainly in the young children. We see that mainly in the schools when these children stands for their prayers, they stand for a longer period and some of them may fall down and become unconsciousness. And the vasophagal attack, it is a very common cause of this. There can be also cough vasophagal attack or micturition syncope or cough syncope. When a person coughs excessively, there can be excessive stimulation of that vagus nerve and it can lead to cough syncope. Similarly, when a person during urination, there can be stimulation of vagus nerve and this is known as micturition syncope. Dehydration, it is another important cause of loss of consciousness. Low blood sugar mainly in the diabetic patient. So when a person takes any diabetic medication, insulin or tablets, but he doesn't take that much food or he skips his meal, then his sugar may go down below 70, which is known as hypoglycemia, and it is also one of the cause of unconsciousness. Low blood pressure, that is blood pressure below 90/60, can also lead to unconsciousness, especially in the standing position. There is another important cause which is known as hyperventilation or hyperventilation syndrome. So any kind of stress, anxiety or because of any kind of incident, if a person abnormally hyperventilates or he takes breathing at a very fast rate, then there can be increase in some of the electrolytes or decrease of some of the electrolytes in the blood, and it can also lead to sudden unconsciousness of a person. Heart problem is a very common cause of unconsciousness because sometimes the heart rate can excessively increase or excessively decrease, which is known as tachycardia, bradycardia syndrome. When the heart rate abnormally increases or decreases, the pumping capacity of the blood, it becomes abnormal and the heart cannot pump the required amount of blood to the brain, and therefore the lack of oxygen in the brain lead to unconsciousness. Similarly, poisoning is a very important cause. A lot of a person can accidentally or by himself or herself can take poisons that can lead to unconsciousness. Any kind of trauma that cause injury to the brain or spinal cord can suddenly lead to unconsciousness. Electric shock, is another cause of unconsciousness. Seizures, if a person has seizures or epilepsy, so a person can become unconsciousness during the episode of seizures, as well as after the recovery from seizures, a person can remain unconsciousness for a certain duration of time. And lastly, another very common cause among the young females is hysteria. So hysteria or any kind of psychiatric disorders, a person can himself or herself can become unconscious, but actually he or she is not unconscious. So this is a psychological disorders, a psychiatric disorders which we known as hysteria. So these are some of the very common causes of unconsciousness or loss of consciousness in a person.
Thank you, sir, for this comprehensive analysis. Sir, my next question is to you that what are the primary care that can be given in like this situation, and what are the things that to be done and what should not to be done in case of unconsciousness person?
So this is a very important question. As I have already said, a lot of us become confused when we encounter an unconscious patient. So in this topic, we will be discussing it step by step how to approach a patient, especially an unconscious patient. So if we encounter an unconscious patient, some of the things which should not be done, like never put any water or any food in the mouth of an unconscious patient, because if you do so, that food or water can go to the airway and immediately cause shocking, or the person can stop breathing. So this is a very important thing to remember, that never put any water or any food in the mouth of an unconsciousness patient. You should not leave that unconscious patient alone, and never try to put any kind of support or any pillows behind the head of that unconscious patient. So because if we put any support or pillow, it will bend the neck and it can lead to obstruction of the airway. The ideal method is that you should lift the chin up as well as head up. So if you lift the chin up, it will straighten the airway and help the person to breathe. Next, don't throw water in the face of the person. This is a common practice, that whenever we encounter an unconscious patient, people throw water in the mouth or in the face as a kind of stimuli. So never throw any kind of water or any kind of liquid in the mouth or in the face of that person. So first of all, whenever you encounter an unconscious patient, try to make him lie flat in a flat surface first. Then look for airway, breathing and circulation. So for looking the airway, breathing and circulation, try to first make the patient chin up. You lift the chin of that person so that the airway becomes straight. Then bring your ear close to the nose of that person to hear for the sounds of breathing. Then also look for the sound of the heart by pressing the ear in the chest. So by this you will know if the person is breathing or not, as well as you will know the cardiac status of that person. So if you know that the person is not breathing or the heart has already stopped, then you immediately go for CPR, that is cardiopulmonary resuscitation. It is the pressing of the chest with both the hands as well as giving mouth to mouth respiration. So if you don't know about the CPR, we will make a detailed video about it, but in CPR you have to compress the chest at least 30 times in 1 minute, and then you can go for mouth to mouth respiration. So you continue CPR, and at the same time ask others for help and ask others to call the emergency services immediately. So in the second scenario, if the person is breathing, if the person is taking his breath normally, then you can shift the person to recovery position. In the recovery position, you take the right hand and extend it to 90 degree, and the left hand you keep in the opposite shoulder, and then you take the patient in one side, then you put the patient in the opposite side. So it will help in two ways. First of all, it will if the person has any kind of vomitus or sputum in his mouth, it will drain away through the angle of the mouth. Moreover, it will also straighten the airway and help the person to breathe nicely. You should keep in mind that the head, neck and the back should remain in a straight line, because if there is any kind of injury in the spinal cord, then it can injure the spinal cord more badly. So always keep the head, neck and back in a straight position, so that the spinal cord remains in a straight direction. Then if possible, try to look for the blood sugar of the patient, because sometimes low blood sugar can make the patient unconscious, and if the blood sugar is less than 70, then you can at least infuse sugar solution. So if the person is cold, or if the extremities are cold, try to put a warm blanket over the person. So these are some of the very common and primary steps that should be done when a person encounters an unconscious person.
Thank you, sir, for this nice explanation. I hope this knowledge or this information is enough to save a person's life. Hope you will like it. So at last, what would you like to advise or request to the audience?
So unconsciousness, this is a very common condition which we may encounter at any moment. So first of all, we should know the various causes of unconsciousness, as we have already discussed, and we have also discussed step by step how to approach an unconscious person. CPR should be known by each and every patient. We should not do the things that we have already discussed, then it can also lead to a person, it can push the person to a more dangerous condition. So let us try to learn how to discuss, how to approach a patient, unconscious patient, and we will also try to bring up more videos how to check for the pulse, how to check, how to do a CPR. So these are very common things that should be known by each and every patient. I hope this video is very helpful to you all. Please share it, like it and subscribe our channel, so that we are motivated to make such kind of useful videos. Thank you all.